Vital Skin Dermatology is the place to come for all your skincare needs. We're excited to be here with Dr. Youse. Dr. Youse, thanks for letting us come in today.
Thanks for being here, Grace.
Yes, absolutely. Let's talk a little bit about Vital Skin Dermatology, who you guys are, some of the services that you guys offer.
Yeah, Vital Skin Dermatology is a multifaceted skincare provider for Central Illinois, but other areas in the state as well as other states. I and some of my business partners and other doctors founded this about 2.5 years ago. And things have just continued to steadily grow. We're glad to be back in Urbana. Opened our location here about, not quite a year ago now.
Okay.
And just really glad to be back in the community, offering good quality dermatology services, good cosmetic dermatology services, surgical dermatology. We try to be really comprehensive in how we approach a patient's skin.
Yeah, definitely covering the bases in terms of the services that you guys offer, as well as your locations around Central Illinois. There really isn't an excuse for people to come see you guys, because you guys are just about everywhere, it seems like. May is Skin Cancer Awareness Month, so today we're talking a little bit about Mohs surgery, one of the services that you guys offer. Let's talk a little bit about what that is.
Sure. Mohs surgery is a specialized, precise type of skin cancer surgery that we use for the most common types of skin cancer, basal cell and squamous cell carcinoma. They far exceed the number of skin cancers that we deal with in other areas by 10 or 20-fold. It's extremely common. Anybody that makes it past 65 and has seen a decent amount of sun is at risk. The fairer skinned you are, and the more sun that you've had and the longer that you live, the risk increases. And so there's a window where we can catch these small skin cancers and really get them taken care of without significant deformity or long-term consequence to the patient. But if patients aren't aware that they have them or don't know to get checked, these skin cancers can grow and get deeper and cause a lot of facial deformity. They can eventually get into bones and nerves. And so the idea is to catch it early, treat it early, and use a minimally invasive kind of precise technique like Mohs surgery to minimize some of the problems that people can have from neglected skin cancers.
Yeah, well, there's a lot of peace of mind to know that such a local, cool place can offer a service like that. But let's talk a little bit about how people can stay on the other side, the preventative side of it, what they should be doing in order to do that.
Yeah, I think that's really what Skin Cancer Awareness Month is all about. We're at the beginning of summer. This is the time when people start to get back out and do some more outdoor activity.
Yeah.
Hopefully not tanning from a dermatologist perspective. That's the one thing we would sort of advise against. But we want people to be active and outdoors. We just want them to be safe. And so I sort of think about this as a multifaceted sort of approach. We want people to use some sunscreen, but that's not the entire answer. We want you to use a hat, some sun protective clothing, find shade when you can. I bring an umbrella to my daughter's soccer games. All of those little things add up. And if you do that over many years, it really can make a big difference. And I see that all the time with my patients. I can tell who's been good with sun protection over their lifetime and who hasn't. And it's kind of like you're on the naughty or the nice list in the dermatology office.
There's no hiding it once you come here.
Your skin doesn't lie.
So how do people know when to come see you guys versus like, okay, I'm noticing a spot or two here and there. How do you know when to come see you guys?
Sure. There's no hard and fast rule. One of the things I talk about with my patients is sort of the ugly duckling. If you've got one spot that just isn't quite healing up or keeps coming back in the same area, it's a pimple that won't heal. That's usually a good sign. Most skin, infections or problems or, scrapes are going to heal within a month or two. If it keeps coming back after, that first month or two in the same spot, something's usually up. And that's when we would say, all right, this spot needs to get checked. That's one of the big things. There's a lot of different rules. If you look online or go to Vital Skin's website, we have some, sort of other, tips and tricks. The ABCDE melanoma rule, where you have asymmetry, border, color, diameter, and evolving. A changing lesion is a big thing.
Okay, definitely some things to keep in mind, especially as we're heading into these summer months. Kind of an incentive to put on that sunscreen or schedule an appointment to come see you guys. Really quickly, I want to make sure we hit on some cool initiatives that you guys are doing to give back to our community.
Yeah, Vital Skin really wants to be a part of this community and give back, and so we've got various initiatives that we take on throughout the year. Skin Cancer Awareness Month is part of it, but to kind of juice that and make it even more special, we're encouraging people to come in and partnering with Feeding Our Kids. a local organization that is, dedicated to helping prevent hunger in some of our young people.
So if people donate food, then they can get a skin check.
Yeah,
Is that how
absolutely.
that works?
Yeah, bring some, non-perishable items in that we can partner with, our nonprofit, and yeah, you can get a skin check and make sure your skin's doing okay.
Well, it sounds like a win-win for me. That's awesome. Well, we appreciate your time here today, and of course, a wealth of knowledge. I'm glad to pick your brain for a little bit. I'm taking in all this information myself. I'll put on the sunscreen. My skin will tell. Thank you so much for your time here today, and of course, we'll connect you with all the details over on our website, ciLiving.tv, and we do thank Vital Skin Dermatology for sponsoring our segment today.